Good afternoon. Dr. Saxena and I would like to welcome you to our webinar entitled Recommending Supplements in Primary Care. And what we'll do is introduce ourselves as folks who have been practicing integrative and functional medicine for several years, have been recommending supplements, and originally both trained in family medicine, still both board certified in family medicine, and actively practicing with patients. So my name is Jeff Glad. I am a family physician by training, practicing in Indiana. I now have, and for the last 9 years, a consultative integrative medicine practice. I left primary care about 12 years ago, and our practice has also sort of moved out of the insurance model and are just fee for service, hour-long consultative visits where we are able to talk about lifestyle, talk about nutrition, talk about stress management, some of the what I believe to be the principles of true healthcare. I did my integrative medicine training at the University of Arizona back in 2008 and 2009. I have recently taken the role of Chief Medical Officer at Fullscript. So now, after practicing exclusively for 10 years, one of my big focuses from a professional standpoint is how can I help scale this message of health and wellness beyond just my little practice, and have done a number of business teaching through AIHM and through the University of Arizona. And so I'm happy to be here with Dr. Saxena, and so I'll let her introduce herself. And she'll probably be very modest, but her bio could go on for probably about 45 minutes to 60 minutes if she gave you the full download of what she's doing on a regular basis.
Too kind. Thank you so much, Dr. Glad. It's always a pleasure just to hang out and chat with you. It's always just a conversation. So yeah, it gives some benefit to know what we do or where we've been so that you can relate to us and ask even more targeted questions. I am a board certified family physician, and I've been practicing, well, I practiced family medicine for 3 years before I was kind of enlightened about this other root cause approach. I started taking courses in functional and integrative medicine, absolutely followed in Jeff's footsteps, and did the fellowship with integrative medicine in 2010 and 11. I'm also on the faculty for the Institute for Functional Medicine, and love to do some volunteer assistant professor work at the University of Miami Miller School of Medicine. We do some education with George Washington University, and most recently, after having run a private practice for 15 years, I've joined Form Health. I am one of the co-chief medical officers, and Form Health is this really innovative company. It's designed to be the first nationwide provider of personalized healthcare, and it's all steeped in the powerful principles of functional and integrative medicine. But what we're doing is bringing small, isolated practices together under a network system. And by doing that, we're going to be able to share best practices. We're also going to share our struggles and see if there's somebody else who's figured it out. This is very akin to one of my other loves, which is the group medical appointment. But we're doing group work with functional medicine, integrative medicine providers who, in their own little islands, have been coming up with genius on their own. And just like Dr. Glad mentioned, he wants it to go beyond him and his little practice. So through Form Health, we're able to share these principles, and the goal, of course, is to be able to show by leveraging data that not only can we make the provider experience more enjoyable with connection and reducing non-clinical burden, but our other goal is through having shared patients and database, we can prove functional medicine and integrative medicine work. Now, we all know this anecdotally, but what really speaks in medicine is evidence. And so leveraging the group here at Form Health, I'm very excited about doing exactly what Dr. Glad is saying, like making this more of what healthcare is versus something that only small pockets of people can access. So we're very excited at Form Health to really get deep into lifestyle, environment, genetics. We're bringing some advanced medical treatments, really innovative IVs, technology, and again, all about collaboration, not just with the patient, but amongst providers and with other people like marketing teams and legal teams, because we all know that's another part of running a practice. So I'm hoping that we're going to figure out together how to make this all work. And supplements is a big part of the conversation, right, Dr. Glad?
No, I think it is a big part of the conversation. I think, as you were speaking, and I understand that the majority, if not all of our audience, would be more primary care providers who are, hopefully interested in trying to bring some of this into their practice, bring some of this into their personal lives. I think, now more than when we were exploring this in the mid 2000s and 2010, the options for education, the ways this can be delivered, is just completely across the board. Really probably quite a bit confusing in terms of, well, where do I start? What do I start with? And so, I think practices like Forum Health to try to regulate and aggregate sort of a group think in terms of best practices is really important for the industry. I think, Fullscript trying to, and we'll talk, a little bit more specifically in terms of, bringing the higher quality supplements to the bedside, accessibility, giving the providers sort of the tools and the information to be able to deliver a high quality product. All these things are kind of that next level, right? That integrative medicine 2.0 that we've been talking about for a couple of years. And so just so everyone kind of understands, on their control panel, we've posted sort of the agenda in the chat box. And that's also where we prefer you to type in questions. So feel free to type away as soon as they come up. We won't field them till the very end, but we'll keep them as a running list. So Shilpa, let's just talk about kind of practicing integrative medicine, right? You do this amazing talk about the different types of patients we see, and really do a great job of categorizing, personalities. But just talk in general about, just day to day, how much more enjoyable the physician-patient experience is for us, being able to practice this way.
Absolutely. I think most of us go into the field of medicine thinking that we're on a mission to heal patients and really bring more happiness into their lives. At some point, the system, which has good intentions, leaves us feeling a little, unsatisfied, right? Unfulfilled, disconnected, overburdened. And what bringing functional and integrative medicine into my daily professional life has done is bringing back what I originally intended to be in healthcare systems. So for me, seeing patient wins where people are actually reversing and reducing disease without pharmaceuticals, through lifestyle, through things that my grandmother used to talk about, like old school logic meets new world data and technology. That's what gets me really excited about being a doctor today. And the other thing that gets me excited is figuring out a way where this type of solution is available to more and more people. And I think that's where some of us who've been doing this for 10 years have realized, like, listen, this is great. But we want to make sure that all patients get a chance to engage with a healthcare provider who wants to get them healthy and happy and off of medications, and that all physicians and nurses and providers are interested in health promotion versus disease management. And most people, most providers, they want to treat the condition. I mean, there's definitely a safety and security in following an algorithm and the standard of care, but it's to a certain extent unfulfilling to the general Renaissance personality that went into med school and residency. Like, we were creative thinkers when we went in, and then we were chefs, like we were chefs in training, and then we go through this system and we turn out to be recipe followers. And there is some degree of mindlessness that's useful, but practicing integrative and functional medicine is about like being a chef again and having people really enjoy the experience of healthcare.
Yeah, I also see it from the patient side, right? I mean, to just see and hear the patient pains of trying to navigate a very difficult healthcare system, not just for the busy practicing doctor, but also for the patient who doesn't necessarily get to spend a lot of time with their doctor anymore, and doesn't get to really tell their whole story. So I've also seen it over the last 10 years, just the increased demand from the patient perspective to have conversations, not just with us who have sort of built integrative practices, but they're frustrated because they want to have these conversations with all of their healthcare professionals. They want to have a conversation about, hey, I wish my primary care doc would recommend, or be okay with my supplement regimen, or criticize my supplement regimen, or recommend, something as simple as, some of the basic things that we'll talk about. So I think that the patient demand also, opens this door for primary care doctors to find opportunities to have these conversations. I know when I was learning this stuff and just started living this stuff, and I was still in primary care, I sort of estimated 20% of patients really wanted to hear more, and I didn't have time for them. And 80% of patients just wanted that recipe kind of cookie cutter prescription. I think that number's probably changed over the last 12 years. So I think the opportunity from the patient demand and interest standpoint is really a big deal as well.
Yeah, I would have to say that I didn't know a lick about functional and integrative medicine when I went into my medical training. In fact, I had this old way of learning about healthcare from the way my grandmother, used to rub turmeric in my mouth and make me ginger tea certain ways when I was sick. And I thought, oh, that's just old school stuff. But what I was very shocked to find out when I opened my own practice in 2004 was that so many people were taking supplements. And in my new patient forms, I could see they were hesitant to even write them down because they thought they would be categorized / discriminated because of this. So when I said, listen, I got to know everything that's going into your mouth and affecting the medications I'm prescribing, I had an awakening about what really is going on for many patients. And as I've learned, I'm not sure if it's still true, but I'm sure it's pretty close, that the supplement industry is over $1 billion industry and either competes with or is actually a bigger industry than pharmaceuticals. So what came to my attention is that as a person who's taken an oath to take care of a patient, I could not remain ignorant about dietary supplements. And it was not fair to me to tell people no on supplements when really what I should have been saying is, I don't know. And I think that's a big distinction that we need to kind of face as scientists. Like when we don't know the answer, that doesn't mean that supplements aren't the answer. It just means we don't know. So that's where I started my inquiry, because when patients really have the opportunity to talk about what supplements do for them, I was shocked, like, oh, there's this thing called a probiotic that you take and it helps your gut symptoms? Oh, okay. And then when I would look, under PubMed, I would see, well, heck, there's research about this. And obviously my pharmaceutical rep was not detailing me on these types of things in general. So I started out in the world of supplements really on a mission to not necessarily protect like I thought they were bad, but like protect like I should know how to counsel my patients. And then I started taking seminars and workshops, and I soon learned, like, oh my gosh, this stuff actually works to reverse disease. And I think patients really want to have a conversation with anyone who'll listen about how to integrate supplements with their pharmaceuticals and slowly reverse out of their conditions and reduce their dependence on pharmaceuticals as much as possible.
Yeah, I love what you said about, and it's okay to say, I don't know. And it probably endears you to patients more than telling them all the stuff you do know.
Yeah.
So yeah, I agree. I mean, I kind of came about it more from a personal journey. I mean, I was taking SSRIs out of the drug rep closet for panic attacks. And when I changed nutrition and studied what supplements may be beneficial for that, you know, and went on fish oil and magnesium and tracked my vitamin D levels, I felt the power. And again, you know, the research supported what I was doing. Is some of that also a placebo effect? Who knows? But I can tell you I was able to get off of SSRIs successfully. So, you know, so back to, you know, our primary care audience and, you know, where do they start? And I think, you know, you listed those things, right? It doesn't necessarily need a $40,000 fellowship program, although they're fabulous and you'll get tons of great information, but you can find great webinars online. Some of them are paid, some of them are free. You know, certainly Shilpa, you're doing a lot of that content and giving those talks regularly. But just go on YouTube, and some of these conferences are streamed and some of these talks are streamed. And, you know, especially the talks where they talk about using supplements for certain conditions and they're referencing the research articles that you can go up into PubMed and look. I think, you know, the more you as a primary care doc who may not understand supplements very well at all, which is completely understandable, the more you spend a little bit of time and then try it out in your practice with the right patient and say, you know, someone who, you know, the topic of fish oil comes up and you say, you know what, I listened to this doctor speak last week about fish oil. Here's how I think it may help you. You know, let's give it a try. And so I think, you know, starting that educational journey without, you know, a big chunk of time or money is definitely accessible and a really highly advisable idea for improving patient care. And I think as you start to do that and you start to see how it lights up patients' eyes and improves their health and gets them excited about your care, and they're coming back asking for more and they're sending friends and family to see you to have these conversations, what then you start to realize is this next step, which is, gosh, should I really be sending them to Amazon or Walmart to go find these supplements? You know, if you look at some of the reports and studies that are out there about how unregulated this market is, and, you know, if we're dedicated as physicians and providers to providing the best care possible, you know, and first do no harm, sending them to Amazon for their supplements is probably not the best step. And so then it becomes, you know, Shilpa, you can touch on this. How do we find and trust, you know, the right supplements? And, you know, and I always talk about kind of the low hanging fruit for the starting out provider, say probiotics, vitamin D, fish oil, you know, going to the drugstore and standing at that counter with, you know, 10 different options and none of them may be clean is a pretty intimidating process for the patient. And, you know, there's a way of, again, building more of a trust relationship with patients in terms of finding the right products.
Absolutely. So, you know, the way that I explained it to my patients in the beginning, when I really did not have a supplement inventory to back, was, okay, well, this is what I've learned. These are the dosages. This is what the form that you'd want it in. Don't do this, do this. And then I would send them to the health food store and just assume, like, oh, okay, that'll be easy for them to find the right one. Great. And then I would realize people were picking different things. So some people were getting better, some people weren't. And then I had all these variables like, well, is it because Joe was also going through stress that his fish oil didn't work, or is it because it's this brand? So when I was actually trying to, in my head, determine, you know, does fish oil work? I had too many variables going on, even though the literature supported fish oil works. And then so what I would do is I listened to these free webinars, and they were many times put on by nutraceutical companies as well, the ones that I could access back then. And I'm a New York skeptic. So when you know, like, of course you're going to tell me yours is the greatest. And then I started looking at the bibliographies of the supplements that they created, and I realized, man, they're doing their research. And the next thing that I asked, again, as a New York skeptic, is like, what's the malpractice for me to recommend this? Like, what if somebody sues me because they use your fish oil and they bleed too much? And when they said, oh, no, we've got $1 million in malpractice covered for anybody who prescribes this kind of stuff. If anything is related to this, we got your back. I'm like, oh, okay, well, that's kind of interesting. So I was just using my new businesswoman, resources and skills to vet out, like, where do I actually send patients to get supplements? What I found out was when I started using these companies that do third-party testing, that really source their ingredients, they batch test to make sure there's no, other things in the supplement capsule that should not be there. Or the other thing that's just as common, as Dr. Glad is saying that there's 1,000 milligrams of fish oil in the capsule and there's 120 milligrams of EPA DHA. So I didn't want to have to, I didn't have the bandwidth to go do that kind of sleuth work on every supplement somebody brought into me from a health food store. So seeing that there were companies that offered these, what they called physician grade pharmaceuticals, was very relieving to me in the beginning. The fact that there was some malpractice behind it, the fact that they many times will have a science officer who's available to me to talk to you about interactions with pharmaceuticals, I was like, this is legitimate. And so I started, this huge step in recommending fish oil and probiotics and vitamin D. It felt like a huge step at the time. And I was actually shocked that it was working as well as it was. People were getting better. And of course, this is being coupled with lifestyle medicine. I do need to make that point that we don't have patients continue to eat at fast food, stress out, not exercise, and think a supplement's going to fix the deal. So coupled with good lifestyle education, just like you said, there's some key supplements that had powerful impact. And as Dr. Andrew Wild taught us, they're low tech, and they have a high yield of benefit. They're, they're high touch because patients are doing this stuff, and the fact that they can partner with their provider and be supervised, and like lab tests can be done and things like this. It's just enormously beneficial to everybody that we understand how to use dietary supplements, good quality dietary supplements.
Yeah, and the ones we're talking about, sort of getting started with, the side effect profile, as Dr. Weil says, incredibly low here too, which makes it, there's a very low barrier to entry in terms of making these recommendations. So now let's talk about, okay, now I've got some education, I've done some webinars, I'm ready to kind of get going, but oh man, do I now have to figure out how to carry inventory and how to sell these, and do I charge sales tax? And gosh, that's an uncomfortable conversation. So here's where the Fullscript platform has solved a ton of those other barriers, right? So now you don't have to carry a thing in your office. Once you've got a couple brands that you've studied or you feel comfortable with, you'll find that the Fullscript platform is now offering a lot of these brands. And really trying to clean up the industry, or at least the offering, in terms of what you can recommend, and so then there's the next level, which I'm not at yet, but you are, Dr. Saxena, is actually having this embedded into your EHR. So I don't. So I have to document inside my EHR my supplement recommendation. I then have to jump over to another screen and log into my Fullscript account and create a prescription for the patient with the product I suggest they take, the dose I suggest they use, and they get an email, and they now handle that transaction with Fullscript, the shipping, the reminder for renewal, all of that. And I'm really, really happy with how clean that tech is and how clean that process is. I can't imagine how much cleaner it is when it's baked into my EHR. And I think you actually have your staff do all that inside of your EHR. And now not only high quality, handling it without hidden inventory, but documented in the EHR, all inside of the Power2Practice platform.
Yeah, I can't tell you, first of all, how nice it is to have an online dispensary, because old school, we had to take on the capital to stock shelves. So first of all, that's a huge step up in providers being able to make sure that supplements are accessible, because so many people will want the supplements available to them within days. We've just become that kind of consumer, whether it's right there on the spot, or if you don't feel like you can house that much inventory, especially in the beginning, to have it available online, because Amazon is popular for a reason, right? Like, click, 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 and something, that you really like shows up at your door in a few days. So what Fullscript allows is the same type of customer experience, but for the provider, the great experience is that even though I have an EHR that I have to do a ton of stuff on, I don't have to be, like multiple personality disorder. Like, I'm going to be a conventional doctor on my EMR, but then I'm going to go over here and go to another platform, and now I'm going to act functional and do my supplements, and then I'm going to go to this other thing. Absolutely nice to have an integrated EHR that allows you to do the clinical documentation and the supplement ordering, and it's a great, of course, log of everything that's going on, and the patients can access that and update that, which is very nice.
Yeah, and I should mention, I don't think it gets talked about enough. I mean, certainly, if as a provider you're independent and you feel like, generating some revenue from these supplement recommendations is something that fits your practice and fits, your business model. That's what I do. I'm a fan of that. I've done the research and the support and the recommendations. It helps keep my practice functional from a business perspective. But I also know and understand the side where we shouldn't make money on supplements, or my practice won't let me do that, or I work for the hospital. And so the other victory of Fullscript is, you can now make these recommendations, know and feel confident that your patients are taking high quality pharmaceutical grade supplements. And if you want to pass them on your margin as a discount to them, then fantastic. You can feel good about you're not generating anything on the supplement recommendation to the patient. The patient's getting a giant discount off of the highest quality supplementation, or you can slide somewhere in between that margin. So I think that's something that certainly you talk to hospital-based providers. They're like, oh yeah, my hospital won't let me do that, so I can't make those recommendations. No, here's the perfect way to make those recommendations.
Yeah, and I would tell you, even within one practice, I might give the full discount to my mother, and then I have a different discount for seniors, and then I have a different discount for staff, so you can individualize it per patient. The other thing that I do, because again, it's costly to have an on-site inventory, is that I give an automatic discount for anybody who orders through the online dispensary. So it's always cheaper to get it online than it is to get it on site, and that's just has worked great. Now then, the other decision that I made is I didn't personally discount all my supplements to cost for my patients. Well, I had my own private practice. Now, of course, there's providers who might have to do that for legal reasons related to their employer. But for those providers who have some sort of guilt, let's say, about making money on dietary supplements, I would just invite you to hear this story. My best friend's husband is a urologist, and we were gathered one night for dinner. And he said, and this was around, 12 years ago, when I was really early into the whole prescribing supplements and stocking them in my office. And he said, it's just unethical that you're providing this. And I said, he goes, you should just send them to the health food store. And I said, well, but those are not reliable. So I like to use the ones that I see an outcome on. And he goes, yeah, but you're making money off of it. And so I said, well, who makes the money when you do the surgery? And he comes from an academic center. So he said, well, I do. And I go, well, then if you are so holier than thou, why don't you recommend the surgery and have them go to another surgeon? Why? Because you know their case and you're only recommending the surgery because it'll make a difference. So for those of you who have some bit of that, like, oh, it's dirty, what I did in the beginning of my practice when I was 100% insurance-based is people wanted supplements. I did the research on which supplements were going to work. I made it available to them. They paid the margin, that came to me and they had longer appointments with me. It was a win-win. Like if you are in an appointment schedule where you're making, 7 to 15-minute appointments, yeah, maybe you want to give it a margin because you're able to see 24 patients a day. But for me, I was seeing 14 to 16, and that's a big cut in my revenue. But these 14 to 16 patients got partnership with me, and they got information about supplements that they could not get from any other person who was doing the extra work to get that information, research. And so I was just paying myself for the expertise that I had gained, just like my friend who's a surgeon, who, by the way, now is a big supporter.
Yeah, no, that's great. I remember that story. Actually, I was smiling the whole time because I've heard that story before. And so I think as you're already on Power2Practice, starting or opening, a free Fullscript account, and your Power2Practice rep can help you set that up. And you can go that step and still not start recommending to patients yet. You can use that, use it for yourself, use it for the family. You read some research, or you're interested in a supplement that you think might help, personally in your home. That would be, just getting started and getting to use the Fullscript platform and understand it a little better would be, really kind of the best next step. I think Hala here is going to show us a video of how the Fullscript platform works inside of the Power2Practice platform. And so we'll walk her, and Shilpa, since you use this in your practice, you might be able to kind of point out a couple things here or there, but then we'll kind of wrap up after that video and then open it up for questions. Again, if you type your question into the chat box there in the control panel, we'll be happy to field that shortly after the video plays. Okay, so that was the video, just sort of displaying how cleanly that would work. And so by making that recommendation, or prescription, if you will, in the Power2Practice EMR, now the patient would get an email into their personal email inbox, making that a super easy click in, create a Fullscript account, and be able to order exactly what you've prescribed for them. Shilpa, any feedback from your staff or patients in terms of how streamlined that is and how efficient that is in terms of your practice?
Yeah, just having everything on one platform saves a ton of time. We don't spend time in data duplication, and I personally delegate as much of this stuff out to my front desk and my nursing team as possible. I just put it in my recommendations and they do all the work, quite honestly. So it's just about, they know my kind of top supplements, so I don't even have to write everything out. I'll just say vitamin D3 protocol or, these types of things. So it is so streamlined. And, once you know the brands and the products that you like, you can create templates for dosing instructions inside them as your favorites, if you will. And then that makes it even that much easier.
Yeah, that's great. That's awesome. Okay, let me see if we've got any questions. Nothing. Again, I use Hello Health for my EMR. It's how I started 10 years ago, and so I once you're on one for even a year, it's hard to leave. So I keep working with them on getting the Fullscript interface, because I do think, as we've just seen in the video and what you're talking about with your staff, it's so clean and so much better in terms of running a practice.
Well, I see a question that just popped up maybe here for me. It's from a Dr. Patel, which is my maiden name, by the way. Do you have any favorite brands on Fullscript? That can be overwhelming when I search for the ingredients I want to prescribe and see a list of options. How do I pick? Yeah, I actually pick many times from the companies that I just have great faith in, from doing research. So I do my due diligence on the company, and then let's say I needed a magnesium. Well, then I will pick the company tab and then type in magnesium, and then I'll see what are the available options, if you will. So that's kind of how I shortlist if I don't have a specific supplement in mind. And does that work for you, Jeff? Anything else you want to add to that?
Yeah, no, I think that's it. And I would say, just in teaching business for clinicians and starting practices, and just personal experience. I mean, so many of us get these recommendations from other leaders and speakers and people they listen to. And so, I'm always happy to say, I'm generally an orthomolecular fan. I'm a Designs for Health fan. I'm a Metagenics fan. And when you start looking at these products and looking for standardized forms and look for the right doses, there's a lot of similarities. And there'll be, so each supplement company seems to be very good at certain things. And so you'll choose your adrenal products from one company, and you'll choose your nutraceuticals from another company. So, I think start with one or two that you feel comfortable with, see how the patients respond, and then make adjustments from there. So another question that came in, I see them now in the question section. So, are you ever tempted to provide acute care to your functional patients, and how do you handle that? That's a really great question. So, as a consultative practitioner, we prefer and recommend that all of our patients have a primary care provider on their own. But as you start to build relationship and start to improve and support the health of these patients, they rely on you, and they want you to be sort of the person they come to for everything. And so we certainly have that ability as time allows, but a lot of our interactions with our patients are virtual in terms of messaging inside of our EMR, and doing telemedicine visits. So they'll reach out to me first and try to sort of help them in the acute case. But then sometimes it's triaging them either to urgent care or emergency care. But certainly, the patient and myself, in terms of acute infections, we're all trying to prevent the antibiotic prescription that is absolutely going to happen if they show up at an urgent care. And it's just kind of trying to determine whether that's appropriate, which is probably maybe 10 or 15% of the time, or can we support you in another way? But everyone, as you build a practice and you start to kind of get into a rhythm of taking care of patients, I think we all want to still be that all-encompassing, do everything for everybody type of practitioner.
Well, I had that disease for quite a long time. I started my practice in 2004. I offered primary care up until July of this year, and primary care includes acute care. Now, I was surely not, handling big lacerations and these kinds of acute care, but I was triaging my urgent care visits. It wasn't, quite honestly, the more I used lifestyle medicine and functional and integrative medicine and education, I mean, maybe some what I call quick fix around colds, maybe some digestive symptoms, but those tapered down quite a bit because my clientele was just a bit different over the years. And now, when somebody goes, let's say somebody calls me to ask me about a cold, if it's somebody who's having recurrent colds, they'll come to see me under my membership plan. And not only might we manage their acute situation about having their, third bronchitis, let's say, for the year, but then we're going to set up another appointment to figure out, like, why did you have a third bronchitis this year? So I don't distinguish for most of my career the difference between functional and integrative medicine and primary care. For me, they were just good primary care includes functional integrative medicine. That's the way I ran it in my small rural town in Florida. But there are practitioners who kind of go out, just like Dr. Glad has kind of alluded to, and they create a consultative practice, and they don't do the primary care portion. So the temptation, I would suggest, like what I tell to my parents of toddlers, don't start what you don't intend to continue. If you don't start having the kid sleep with you in the bed, if you don't plan on that kid continuing to sleep with you in the bed. So for this, like, unless you want it to be one of your service arms, or maybe you can qualify it and say, this is what we manage in the world of acute care. But like, people don't come in to see me with chest pain. And, when they say that they're having that, we just say, you need to go to the ER. There are a certain line on what version of acute care we're willing to manage in our practice.
Yeah, no, I think we're on the same page there for sure. Last question: are there a few supplements that you recommend and believe every patient should be on?
Yes. All right, you want to go first, or you want me to start?
No, you go first. I'll supplement if need be.
Oh goodness. Okay. So I would say most of my patients are on a D3, and since they're adults, a D3K2. I really like Orthomolecular's options for D3K2. They source from a very reputable company that has evidence behind it. So D3K2 is great. Then another one that I'm commonly prescribing is magnesium. Now, I don't have a particular company. Honestly, I like companies that Dr. Glad mentioned: Ortho, Metagenics, Designs for Health. I also recommend a probiotic. That's Therabiotic Complete Powder from Claire. It's not grown on a dairy medium, which I really like for many of my patients who have dairy concerns. So we talked about probiotics, vitamin or D3K2, fish oils, so EPA, DHA. Metagenics has great fish oils. Orthomolecular has great ones. Those are the ones I go to generally. Then the other one, just because of the nature of what I'm doing often, is taking care of patients with autoimmune conditions. I don't only actually like supplements that come in a bottle. I like functional foods. This is one of my big, idiot-proof solutions when I was going into functional and integrative medicine. So one of my personal favorites right now is Orthomolecular's Inflammacore. I mean, you have an autoimmune patient, especially if they're inflammatory bowel disease, there's such great evidence, and as well as anecdotally, I see that work very well for my cardiometabolic patients. And if I couple that with Metagenics Ultra GI Replenish, that one scoop of each makes this great palatable daily shake. You can use detoxification functional foods. And so what you do is you get the protein that's hypoallergenic, and it's anti-inflammatory. It's got the right combination of, protein, fat, carbs, so it doesn't make their insulin go up. And it's a shake. So you don't feel sick when you have a cool shake in the morning. Like, you feel kind of hip, and here I am with my shaker cup. And listen, this stuff has got to be a little sexy for people to take it on, for those of you providers who are pitching it to your patients. And I don't mean to be too funny about it, but it's true. Like, people like to go to Starbucks versus Dunkin' Donuts for a reason. You just feel smarter when you're in a Starbucks, maybe. And so these kinds of shaker cup things, always great. So functional foods. Let's see. What else am I thinking that I do? Bergamot is another big one that I use for a lot of my patients who don't want to take statins. So Orthomolecular, again, has a great bergamot product that I use. Now, I don't take people who have high risk off of a statin and put them on bergamot. I use bergamot to help while I work on lifestyle medicine and slowly try to pull them off the statin if they're high risk.
I think the only two that I would add sort of off of that would be berberine in terms of insulin resistance and type 2 diabetics. Again, not to replace the medication yet, but just to help either the pre-diabetic or the patient who's, the A1C of 7 and refuses to start the medication. And then, not every patient, but most patients, I think if the supplement list already is not very long, in terms of what we're trying to treat or address. I like a multivitamin for most patients. Usually, it's hey, we're going to start with these 4 or 5 things to really target. You had low iron, you had low B12. Let's get those up, but let's work on diet to improve that. And the goal is then let's transition you to sort of what Dr. Weil calls the insurance policy of just making sure you get all the little micronutrients every day. My current favorite is ProThera's MultiThera. They have a variety of different options. Some are iron-free, some have iron in them, but that one seems to have the best forms of the different nutrients. And then, for kiddos, they've got now Designs for Health has a nice effervescent powder where, again, you can give them the cool factor of making this little sour drink for them every morning that they kind of get excited about. And now Da Vinci has a new line of kids vitamins as well. So yeah, I think that's a good list to start with. So I want to mention that I know that some attendees were not able to view the video. So if you did not see the video demonstration of Fullscript being used inside the platform, we'll be sending that recording over after the webinar to everyone that was in attendance here. So you'll be able to view that video. If not, your Power2Practice rep, I'm sure, would be able to kind of send that to you. So we'll have that available. I believe we're also packaging this. If you missed parts of this or recommendations or said, hey, wait a minute, what did Shilpa say about statin folks? So this will be available to you somewhere in the near future. So with that, I'll wrap up. Dr. Saxena, always a blast sharing the stage with you. I hope to do it more often, and enjoy your new office building, and I'm sure we'll cross paths here real shortly.
Thank you so much, and good luck, everybody. Take this on. You've done great things in your past. You're continually capable of taking on new steps to, really support your patients and what they're already doing.
Absolutely. All right, we'll sign off there.